Hello, welcome to Misconceptions. I am excited to have Rivka Sidorsky here with me today. Rivka is a certified sex therapist, a general therapist with this added training, which we'll talk about in a minute. But first and foremost, welcome to
Thank
Misconceptions.
you.
So, I have had the privilege of working with Rivka as my own supervisor. So, I am also in training to become a sex therapist and almost completed all the educational components of it, but working towards certification is kind of a cumbersome process. But I have had extreme privilege in working with you as a teacher because I don't even just call you a supervisor. You're teaching me so much, and I've enjoyed every minute that we have spent together. And that's why I asked you to talk with me today. And we're going to talk about, different topics relating to women, specifically women's sexual health, and just see where the conversation takes us. So, welcome. We're happy you're here.
Great, thank you. It's really my pleasure, and I've also enjoyed every minute I've been with you.
Thank you. So let's start with, why don't you tell the audience what it means to be a sex therapist? I will tell you as a joke, my father would be attending my Shabbos table, and I'll say something about like being in school again when I was in the program, and he's like, "Can we call it something else? Like, do we really have to say that at the Shabbos table?" And I think that's one of the challenges that I have with the title of sex therapy, but there isn't a better one that comes up, that kind of comes with the territory. But let's talk about the process of becoming a sex therapist. Tell us what you know.
Sure. So usually people will do a master's program in social work or counseling or psychology, or maybe they will get a PsyD or a PhD in psychology. So those are some of the educational backgrounds that would somebody would have, and really in most of those programs, you're getting a very general education about relationships, mental health diagnoses, family dynamics, attachment issues, a lot of background, which is really, really great information. And we use it all the time. Um, the added training in sex therapy adds on this additional knowledge of how do we help specific sexual dysfunctions. So that's something that we're not typically seeing in master's programs or any doctoral programs, typically in social work or counseling or
Right.
psychology. So you're really getting that added training on how do you deal with low sexual desire, how do you deal with erectile dysfunction, how do you deal with pelvic pain or anorgasmia, for example. So those are some things that you would have that additional training. And a lot of therapists in general don't they kind of believe that if your relationship is good or your mental health is good, then your sex life will be good. But I really see it's not the case. I really see a lot of people with good relationships and good communication and loving relationships, loving marriages. And the sex is really its own problem. So I really do believe that it needs to be treated with its own treatment, not only just make the relationship better and then people will have a better sex life. So that is one of the things. And then just anyway, speaking about sexuality or sexual issues, even in a master's program or the types of classes you would take, we just get very, very little exposure to talking about those type of topics. So many people just really don't have the experience talking to people or clients about this issue. And then you have your own insecurities or your own feelings of anxieties talking to people. And most of the time, therapists feel like they don't want to be nosy. They don't want to come
Mm,
off as
mm,
nosy.
mhm.
So they don't know how to ask people about this area of their life without appearing nosy.
Sure.
And so they lack the confidence to know how to navigate these types of conversations. So if you were
Right.
to go to a sex therapist, they would know what kinds of questions to ask, and they would feel comfortable talking about these things, hopefully, so then you would feel comfortable talking about these things.
Right, right. I think that's very important because I want to go back to that one line that you just said about that the comment that you made about you could have an excellent relationship, an excellent marriage, an excellent partnership, and yet the sex, like the things that are happening in their intimate spaces, might really be problematic. And I'm wondering why is it that the healthy relationship doesn't automatically mean a healthy sexual behavior, sexual relationship as well. What are you noticing?
Mhm.
What do you learn? What are you seeing?
So your sexual activity, your relationship with sex is multifactorial. So one of the elements is who is it that you're having sex with? But another aspect that impacts your sex life would be your general own mental health stuff. For example, your background of anxiety, your background of depression, your background of trauma. Another thing that would be relevant is also just your physical body. So you could have the best relationship, but if you have some physical concerns going on, whether it's pelvic pain or lichen sclerosis, or um, you have like some hormonal issues, you have your pregnancy, you have endometriosis, there's lots of medical conditions that you yourself might have, going through infertility, there's lots of things that you might be going through, separate from the relationship itself. And other things that would impact a sexual relationship, for example, would be your self-esteem, your body image, your relationship with your sexual body parts, such as your genital self-esteem, like how
Mm.
you feel about your private parts.
Is that like a
Are you
thing? Is that
Yes,
terminology is like genital
genital
self-esteem?
self-esteem.
Hey,
So
have learned a
yes,
new word. Got to put
so
that in my notebook.
how you feel about the smell, the taste, the look. And
Mhm.
if you're really concerned or anxious about those things, that can affect your sex life. Even if you have the best marriage, if that is a preoccupying um, worry or concern for you,
Sure.
that's going to affect you. Or it could just be general weight issues, general body image issues. It could be the way that you learned about sex, and just feeling disempowered, like you don't know what's what, uninformed. That could be something, for example. So all these other issues could be going on in the midst of a loving relationship.
Right.
And your
Right.
husband can be
Right.
telling you that you're beautiful, and
Right.
you smell great and you look great and all these things. But if you don't believe it, that's going to impact you.
Absolutely. And I think I want to like zero in just for a moment as well on this idea of the influence of culture and religion, right? So what are the stories we were told about sexuality or sexual behavior from a very young age, or what were we not told? And we don't have to go into the details of that, but I think it's necessary for us to say those are going to influence how we experience sexual behavior and sexual relationship within the relationship of marriage. And um I think that that's something that's a nuance that's very unique to within the Jewish world or the Jewish Orthodox community. For the purpose of this conversation, we know it exists in other communities like purity culture, Mormonism, things like that. These are the same kinds of issues that are going to present, and we're hearing more and more about that. So even if you had the best kala teacher, the best bride education, the best chassan teacher and groom educator, there are still going to be components of this that are going to be confusing and possibly disorienting when coming into a relationship and a marriage.
Right. Like how do you remain sneas and have a sexual relationship, or how do you merge these two ideas,
Yeah.
for example?
Right.
I think what's very interesting is, how do we prepare young people to have a great sex life before they're anywhere near to having sex?
Hmm.
So what are the building blocks in elementary, middle, and high school? And I'm talking even back in elementary, really, or preschool. What are
Right.
the building blocks that'll set your children up for success? And that's one of the classes that we've been doing now in my practice. We offered a class, and it's just been really, really fascinating to learn. I was attending, I was attending the class. It's been really fascinating to learn, what can you do with a 3-year-old? What do you
Mhm.
say with a 6-year-old? How do you develop those building blocks so that they have a positive relationship with their body and are prepared in a healthy way for sex? And it's
Mm.
just so interesting, the components there. it's it's that communication, it's the awareness of your body, the connection and awareness of your body. It's the being able to advocate and feel empowered about your body, as far as, you go to the doctor and you are 6 years old, but how much consent are you practicing at 6 years old? Or you're 9 years old and you say you have a stomach ache. And what does your mother or father do with that concern? Are they listening to your body? Are they dismissing your body? Um, Also, the relationship with your parents, what they're modeling as far as intimacy or romance or love or affection or body image. So
Mm.
those are things that all of these building blocks, and also communication. If somebody, it's about boundaries and communication. It's not just about, if somebody touches you in a sexual way and you don't like it, saying something to somebody about that. It's about, if somebody touches you in any way. It's about somebody pushed your shoulder, or somebody, knocked something out of your hand. So it's about the boundaries of how other people are interacting with your space. It's not only if somebody touches your private part, then do this and that. So it's
Interesting.
all these things that we can prepare our children so that they can be successful. And I think it's we have to see the zoom out picture.
I think that what's so fascinating to me is, I am sure that when you bring up that statement and you say, well, what are we going to do when they're in elementary school and even before elementary school? I know most parents are like, I'm going to press pause on this podcast because I am not doing sex ed with my kid in middle school, elementary school, or before that. And yet, what you just described is that what we're recognizing is the relationship between a healthy sex life, sexual health, sexual identity within a relationship context specifically is actually dependent on those building blocks that you just said. That idea of my relationship to my own body is going
Mhm.
to impact me in my relationships in the future, right? And that makes so much sense in terms of, like, I think most of us as women can identify very clearly with things like body image, right? If I don't feel pretty, then my relationship with my spouse is going to be a little bit impacted if I'm hiding my body, right? But I think that what you're talking about is things like body autonomy and the ability to say that I like or don't like something, and just actually listening to body cues. And I mean, what would be the harm in doing that in a 3, 4, and 5, and 7, et cetera, child? And isn't that interesting that we would never have made that connection from
Exactly.
childhood into
The
adulthood?
link between these things, like that, when I see an adult, because I only work with adults, when I see an adult, you can find out in their backstory what created these vulnerabilities. So
Mhm.
you're looking at, oh, the parents' relationship with each other, or the parents' relationship with the child, or the type of attachment issues, or all these things. You see it in childhood. So it's if you can see that in the adult, why not look forward a little and try to do a little bit of that preventative work so they don't become a client.
Right, right,
Right.
right, right. Exactly.
Yeah.
Although that would be good for business, it's probably not good for society. Exactly. So, can you give me an example? I'd love to kind of give an example where you've seen an event or experience in an adult patient client that you immediately can correlate back to a childhood experience relating to their either lack of body autonomy or lack of body of trusting their body. What have you seen in some of the clients? Many of them you and I have discussed them as case examples, but what's the one that you would wanna highlight for our audience?
Oh my gosh, there's so many. Let me think. Let's see. I mean, what comes to my mind immediately is is shaming, because I think that I've seen that have a very long-term effect on people. Um, so, something like you're the rabbi's daughter, or you're the clergy person's daughter. And so you have these very high expectations of how you should behave because you are representing your family and these like virtues and values. And um I think that there's a lot of pressure on those girls, for example, like clergy children, to dress everything that they're dressing, every way that they're acting. I had one woman tell me that when she was in like, I don't know, eighth or ninth grade, she would just happen to be like walking with a boy, and they were talking, and it was relatively innocent. And people went and told her family, and she was extra shamed and scolded from her family, because this was improper and immodest, and you're embarrassing us. And messages like that make you feel like you really don't, you're really shamed at like any exposure to sexuality. um or there's tons of examples of women feeling completely unprepared for their menstrual cycle, and for that to be a very scary experience. um that's not really a great feeling for somebody to go through as a child, and the connection between that and then their whole reproductive life and their whole relationship with their vagina. um I mean, there's so many types of stories. Is there any
No, that's
story?
okay. I think the one I'm thinking about is like that idea of trusting or knowing my body. That I think about how often we would say to a child, like, I have a headache. I can't go to school. No, you don't. You're going to school, right? I'm not hungry anymore. Yes, you are. Finish eating what the food that I gave you. Like that.
Totally.
Those are the correlations that I'm hearing that are not having anything really to do with sexual experience or even boy girl stuff. And it's but just that is enough to really throw off a child's ability to say, no, I can trust my body. That if my body says that I'm hungry, I'm hungry. If my body says I'm not hungry, I'm not hungry. And kind of navigating that as parents can be a little bit complicated because
Yeah, I mean, if
so
you
confusing.
begin to
Yeah.
um if you begin to trust your children's experience of their body, I think that could be really empowering for them. Like, for example, they go to the school nurse, and the school nurse is telling you on the phone, oh, your child has blah blah blah, what do you want to do? So a great thing to do is to immediately first ask the child, and just to be like, what do you feel? Like, do you feel like you need to go home? Do you feel like you can stick it out for the rest of the day? Hear first from the child. And that could be the same with, if they have an earache, or if they feel like really, really tired, you can offer them suggestions. Sometimes if you get up and if you eat breakfast, you might feel better. And let's check in how you feel after that. It's not to say you can't give them any direction or advice,
Right. Right.
but kind of knowing and saying you're the expert on your body, so you're going to know best, saying that to your children.
Yeah, I think that's very powerful. And just in moving on from there, I think, one of the things that I really wanted to make sure that we address is I want to bring up one topic. Like we've talked before, we can bring up many, many topics to discuss, and each of them could take a full podcast. But I was thinking about really a focus on sexual pain, and the reality of there are women out there who say, you mean sex is not supposed to be painful? Like I thought that that's just normal. Could we
Mhm.
set the stage a little bit about what's normal, what's not, and what do people need to know about sexual pain
Right. I
or
mean,
painful
first
sex?
and
Let's put it that way.
for
Painful
yeah, I
sex.
mean, first
Yeah.
and for I had a woman tell me that when she was in Kala classes, her Kala teacher told her that it was going to hurt, and the teacher meant it was going to hurt the first time. But what the Kala heard was it was going to hurt always. And so when it was hurting always, she didn't know anything other than that would be normal. So I just remember that kind of stuck out in my mind, that it was a misunderstanding, but clearly this Kala had not gotten any of the positive messages, right? We get a lot of the negative messages. We get all the messages as children and growing up about, if somebody touches you like this, then, tell me or tell someone, it's all this, the negative messages. And when are we ever telling the children at any age, that this is a beautiful thing, and then this is supposed to feel good emotionally and physically? When do they hear that message? So going into marriage, I think that we want to, or preparing anyone for having a sex life, a positive sex life, I think we want to make sure they understand that this is supposed to be a positive and intimate and caring and loving experience that's supposed to feel good for both people. And if it's not feeling like that, then there's something that we have to figure out or work on. That is the expectation. This isn't something that you are required to do, or, well, we just have to do that, just like we have to, clean the toilets. This is not something like that. This is something we get to experience. And I think that positive language gets missed, and then people don't even realize that they're really not experiencing what they should be experiencing. As far as pain is concerned, it's an interaction with your physiology, your psychology, and your relationship. So sometimes there's different reasons for pain. So sometimes there are real physiological reasons for pain. Like you might have hormonal deficiency, you might have lichen sclerosis, you might have vulvodynia or stabilidynia, you might have pudendal neuralgia. There's lots of diagnoses. You might have infections or endometriosis. There's tons of possibilities for explanations from a physical standpoint. And a lot of times those physical conditions can often cause a pelvic floor dysfunction. So when something is feeling painful or not quite right, our muscles will involuntarily react as a result. So there's kind of this there's this reaction between our muscles and our and then this physical etiology of pain. And sometimes our pain is more psychological, in the sense that we feel very, very fearful of intercourse, or we feel very, very anxious. And that can cause a involuntary muscle reaction, which causes real pain. So, that can cause muscle reaction, or a physical reason can cause a muscle reaction. But all these things just kind of bounce off each other, because if you have one, it can cause the other. If you have a physical reason for a pain, then you're probably going to have some anxiety, avoidance, aversion, fear as a reaction. So there's all this interaction of this all. And then there's the relationship. I've had other situations where a person can have no pain with themselves, but they can have pain with a partner. So in that sense, that's a bit more of a relational anxiety that's causing a clenching or a anxiety reaction in the muscles, a hypertonic muscle reaction. And so that could be an explanation as well. So nevertheless, there are really a lot of explanations for kind of like what all is happening,
Right.
what's the root of the issue, which is causing this next thing, which is causing this next thing. And you really want to go back to the root of the issue instead of only figuring out one of the solutions. You want to figure out all the pieces of the puzzle.
Hmm.
So you want to work with a medical expert and a physical therapist and a psychotherapist. You want to work with all these different people because inevitably it ends up being that the things cause each
They're all
other
connected.
to
Right.
happen.
Right.
Yeah. So very rarely, I think one time in my entire career, I saw a woman who did not have a psychological fear aspect of pain. She only had the physical aspect.
Hmm.
And that's very unusual. Most of the time, the physical reason for pain causes emotional avoidance, anxiety, aversion, fear. But only one time did I actually experience that somebody did not have that reaction
Hmm.
and they still enjoyed and they didn't have the fear. Um,
But they
and they
still had the
didn't
pain.
avoid. They still had the pain, but they actually didn't have the like psychological impact of it.
Interesting.
But usually that
Interesting.
is uncommon.
Right. So I guess it comes to me. One of the things I'm thinking about is this idea of like how many times have women ended up in OBGYN offices or their primary care doctors, and the doctors are saying, look, I think, and I think we've gotten a little bit better about it, but they're like, look, we've looked at it physically and there's nothing wrong. And
Mhm.
so it's all in your head. But I think what you've just given a much deeper explanation of what does that mean when somebody says, well, it's in your head, it's psychological. And I think that could be incredibly invalidating because basically what I think the medical community historically has said is it's all in your head means there's you have to just deal with the psychology of what's wrong. But you're
Mm,
saying you're talking about that psychology and how the psychology impacts the physical. That pain is very real. But yet what we're coming into a deeper understanding of is how the psychology of what our life experiences are and our history and our relationships, how that impacts the pain experience.
yeah, everybody knows that if you have tremendous anxiety, you can end up like with a stomach pain, with a chest pain, vomiting, like you can have actual physical symptoms.
Right.
If you have depression, you can have actual physical symptoms of fatigue or muscle aches or um pain in your back or
Sure.
that absolutely your mental status as far as anxiety or depression or fear or one of these types of reactions can cause physical
Sure. Sure.
actual physical reaction.
Right. Right.
So
And
definitely
sexual pain is no different. Sexual pain
exactly.
is no different. Yeah.
And your body is acting out it's a physical display. So you instead of being frustrated with your body that, hey, ugh, my stupid vagina, like you're making me not be able to have sex. Instead, you should be like thanking your vagina that it is trying to send you signs to help draw your attention and alert you, hey, there's a problem here
Mm.
because
And
we
the
don't want to
problem
just
is
force it.
right. Right. And that the problem here is not necessarily a problem like not necessarily a problem like, look, there's an injury, but that there's a psychological injury that needs to be addressed. The anxiety, that just whatever it is that's coming into the room with that client is what needs to be addressed. Yeah.
Yes, and so I think, well, I mean, as far as this whole doctor's visit, I think that there are very few medical doctors who are actually trained in pelvic pain conditions. So
Right.
just because an OBGYN told you that there's no physical etiology, that's not necessarily true. There are advanced testing that can be done if you go to a pelvic pain doctor. So I think that don't just trust like a general OBGYN to really be able to rule out conditions because these are really specialized conditions. it's very possible that if you went to a specialist, the specialist would say, oh, wow, you actually have a nerve condition, or you actually have a hormone deficiency, or you actually have, this or that. So first of all, don't just go with a general OBGYN.
Right.
And second of all, I think even if it has an emotional cause, it ends up interacting with your body.
Mhm.
So then
So
you
who are the
need
specialists? Like, where would you send them? A pelvic pain specialist is what? How would you define that from,
like a
like, what is the
sexual
criteria?
medicine doctor.
Sexual medicine doctor, is that an OB? It's probably not an OB. We're looking at probably a urogynecologist.
It could
What
be
is their
urogynecologist, it could be
certification?
urologist, it could be gynecologist. So somebody who is saying that they specialize in sexual pain, um, usually someone like that is more specialized in this area rather than a typical OBGYN.
Okay. Okay.
Yeah.
And I think that's necessary because I think sometimes, we want to trust our medical providers, and we should trust our medical providers, but sometimes people don't know what they don't know, but they know that they can't help you. And so they'll send you back to the therapist's office. And really anybody who's working as a sex therapist needs to have more of a collaborative, team-based approach. Like, your team is going to include many different people, as some of them you mentioned before, that's going to effectively or successfully treat these kinds of conditions. Why don't you pick one condition? Can you give me one example? What's the number one condition that you might see when it comes to sexual pain?
Um, Very commonly, I would see a hormonally mediated vestibulodynia.
Okay.
So that means that that you have a hormone deficiency, or deficiency in your body, which is leaching hormones from the vulva. When that happens, it can cause the vulva to be more dry or brittle or painful. Um, and that might be, a patient might describe that as more of a sharp pain or a dagger, or, dry, brittle. Um, that would be how they would typically describe that. And this is often caused by certain medications, like hormonal birth controls that they might have taken in the past. So even if they're no longer on a medication, there are medications like hormonal birth controls, like pills, or for example, certain acne medications that cause this condition. So, and even once you've stopped, or um, but I mean, certainly if you're still on. So what we what we see as a result of that hormone deficiency is that your muscles react, because when something is uncomfortable to the touch, the muscle is going to react around it. And so your muscle will then start to become more hypervigilant and reactive, um, and trying to avoid the pain. It's trying to give you a message like, oh, this is going to hurt. So, don't come near us. Um, and then from there, so then that caused a muscle pelvic floor dysfunction. And then from all this, you're going to develop a avoidance of sex, you're gonna or an anxiety with sex, or a fear of sex, a fear that it's gonna hurt, and then these people end up not enjoying anything. So they, typically they don't enjoy hugging and caressing and kissing and oral sex and other, because this has sort of seeped into their entire sexual um relationship, that they really start to not enjoy any, and they just try to avoid. um so you can see how all these things spiraled into where we are today.
Right.
And then when they get to me, that's sort of like where they are, which is, it always hurts. They don't have any strategies. They tend, maybe the husband has pretty much stopped initiating because tons of rejection, and there's a dissatisfaction and hopelessness for both people, and they just don't know how to dig themselves out of this hole. um, and what I would do with them is I would first and foremost send them right away to get a complete evaluation. What is happening medically? What is happening with the pelvic floor muscles? And then what is happening, here with psychologically and in the relationship? So we would want to do a thorough evaluation, and then we can begin to reprogram this connection so that it is no longer everything is tainted, but instead, how can we begin to enjoy again? How can we begin to experience, a pleasant reaction?
Right. And when you think about these cases, when I hear you describing that, how can we begin to enjoy again? I think it's such a necessary discussion to say like that this is a valuable, important part of a relationship. Now, it's fine if both partners could care less and this isn't of interest to either of them, but in a typical relationship, we would consider sex as being a necessary, valuable, integral part of a relationship. How would you define it?
Yeah, I agree. And if if it is fine with you, then it's not a problem for me. But
Right.
usually you come to my office
Right.
because it is a problem for
Right.
one or both people. Um, and I think that it's interesting because a lot of people bring the real complaint tends to be that she doesn't enjoy sex. And so, he wants her to enjoy. And then that's really what he's after. And I like to tell people, look, you had a lot of bad reactions or food poisoning when you ate chicken. Like, you ate chicken and you threw up and had diarrhea and you got sick, and not only once, but this happened over and over and over again for I don't know how many years, right? Because these people aren't coming to me 1 month after they get married. So, usually. So how long has this been going on? Is this a year? Is this 5 years? Is it 10 years? So how long have you been eating chicken and having this reaction? Imagine in your brain that with more and more exposures to the same reaction, your body is making a very strong link between chicken and pain.
Right.
So then you ask yourself, would this person enjoy or crave chicken?
Right.
No.
Right.
Of
Right.
course not. That's functional. Your body has created a distaste, but also they don't crave this thing that makes you sick.
Right.
So the aversion actually makes a lot of sense. It's avoiding something, is averse to something that is harming you. So then, of course, they're not enjoying it. Of course, they don't desire it. People come to me, well, why doesn't she desire sex? And I'm like, well, would you desire chicken if every time you ate it, you were sick? It
Right.
makes sense. You
Right.
wouldn't desire it and you wouldn't crave it and you wouldn't enjoy eating it because you'd be thinking about how it's going to be awful and how you're going to be sick and how anxious this is making you feel.
Right.
So it just makes sense in your brain. What we have to do is we have to reverse immediately this reaction. So we
Right.
have to begin to figure out how we can tolerate the exposure, um, and it be a different experience. So, like, from today on, there's no more painful sex. From today on, we're gonna have a different experience. Is it gonna be orgasmic? No. Are you gonna desire and crave it? No.
In
But
at
are
the
we going to
beginnings of
figure out
some
a
right.
way
Mhm.
for it to be pleasant and okay? Yes.
Right.
And from there, we'll get to it was actually okay, and then from there we'll get to enjoying it, and the very last step is desiring it.
Right. Isn't that interesting? Because like you would think that we always talk about the different kinds of desire patterns, but that desire does not have to be first. The desire for improvement, the desire for making things better, the desire for this within the relationship really is the desire piece for these individuals and these couples. So, being mindful of our time, because as I say to every person I speak to, I could speak to you for hours, but I'm wondering, this really gives us a good case scenario or case example, or just an example of from diagnosis or from exposed to from somebody coming out and seeking help, that there is, first of all, there's hope. And I think that that's really necessary. And I think when you are with an expert who really understands the processes that are necessary to get you better, there really can be hope. And I hope that the people who are hearing you describe that see that this isn't one of those like, well, you're just never going to be able to have enjoyable sex or pleasure again, and sorry, go along your married life or get a divorce. And that is really an outcome that should not happen when people get support. The other thing that I do think is necessary to acknowledge is we we really should be encouraging people to get help much earlier, right? When somebody comes to you after 5 years of eating chicken, it's going to look quite different than comes after you 3 months of being sick. And so, really, this kind of pain, this kind of aversion, this kind of dissatisfaction, we can help you if you, but it's so much easier to help you when it's not in this more intractable state and this more crisis state.
Absolutely.
Yeah. What would you say are the top three, two or three misconceptions you have that people have out there in the world about either sex therapy or sexual health, any of those things? What would you like
Mhm,
to kind of
mhm.
counter?
Okay, so I was thinking about this. There's so many things to say, but one thing is that many people think that in order to have sex, you need to get excited. The mood needs to be excited, and it's actually quite the opposite. What we need is for you to have a relaxed um, neuro state. So it's only when you feel relaxed and your body is relaxed and your nervous system is relaxed that we're able to experience pleasure and connection and not feel threatened and not feel pressured. It's only through the mood of a true relaxing experience. So if you're having a hard time, starting, which a lot of people have a hard time getting into it or starting, the go pedal, the gas pedal is that's a you're at a stop, and getting you to go is really hard. I would say you don't need to go for like exciting or get in the sexy mood or something. I would say go for the relaxed mood. Just go for a really calming mental state, a calming sensory environment, a calming, lighting, calming music, calming room, talking. That is really the way to get going. And when you're in that type of mental space, then you can be receptive to a little bit of touching, and the little bit of touching will hopefully feel pleasant and nice. And then from there, you can do a little bit more. Um, so I think that would be a good place to start.
Mm,
Another thing that I see a lot is that people kind of misunderstand men, women misunderstand men, and they think that men just want sex, sex is sex, and it couldn't be farther from the truth. Men have a lot of feelings about this. They have sex means a lot to them. It means you love me and you want me and you desire me. It's not just sex is sex is sex. And if you really, their words that might come out of their mouths might say, I want more sex, or I want to have sex, or like those might be the words they're saying, but what they mean is I want, or they might be saying I want you to have an orgasm. That might be something that comes out of their mouth. But what they mean is I want to feel wanted, I want to feel desired, I want to feel like you are really enjoying me. And I don't think that women really get that
mm,
much of the time. And so they end up just giving their husbands like when, like, I call it like gas station sex, which is that the husband is like a gas pump, and the woman just drives up in the car and he just plugs it in, fills her up with gas, and then she just drives away. And I've had men tell me that's how it feels to them. It feels empty, and it's almost like really not even worth doing it because it's that empty feeling and dissatisfying. And that's not what they're after. Sometimes they might take anything they can get, but that is really not what their emotions are looking for. They want you to be active and enjoying them. And I just really want the women out there to see that more depth about the men that are in their lives. And if you are a man listening, um, I think you, I think that I hope that you feel like, yeah, that's something that I do feel, and it's hard for me to say that. So it's
Sure.
easier for me to
Sure.
say that I want more sex or that I want sex, and it's harder to say I want connection or I want to feel loved or I want to feel like you want me. And when we have sex, I can feel that, or I hope to feel that. And that's why I'm asking for sex, or I'm asking for an orgasm from you. Like, that's important to me because I want to know that I can satisfy you and I make you feel good.
Sure.
So sometimes if we get men to kind of more speak in a more in that
In
language,
an emotional language. Yeah.
emotional
Yeah.
language, it can
Mm.
go over better. And then the third thing is that a lot of people feel like we have to get this, sex up and running before we get married or before we have children, because as you have children, your sex life will inevitably decline. And I think that that just is so completely opposite from what I believe. If you rely on novelty in your sex life, then sure, it might decline then when you're married longer or when you have children. But if you connect sex with, intimacy, connection, pleasure, then sex just only improves as you're married longer. Because as you go through more things in life and you go through experiences together and you go through challenges and you get through things together, then you reach deeper levels of emotional intimacy. And then that should really be showed, reflected in the physical act of expressing your emotional relationship. So really couldn't be more from the truth. And I think that as you're married longer, I hope that most people have the experience that it only gets better and better. It's such a depressing thought to think your best sex is
Right.
the first year of your marriage. I mean,
Right. Right.
that's a
Right.
no.
Right. I think that everything you just said has such hopeful tones to it. And I think that that's like to me just the loudest message that you just offered, especially about like talking about the misconceptions of sex and sexual health, is that there is so much hope available in this space, and so much of that is so value aligned with, with a religious life as well, which we could always talk about another time. But I think this has been an exceptional conversation. I do think it's important. One comment I just want to make about that first misconception about being in a relaxed state, no matter when this podcast comes out, knowing that there have been some shifts in the world and in Jewish safety and the Jewish life that many of us live. If we go to bed right before going to bed, we're scrolling through, the scary podcasts and scary clips and scary news articles or about any of the tragedies of the world in general, it is not likely that that transition to bed is going to be easy to then be in a relaxed and quiet state. And so really thinking about, if I need to be in a relaxed and quieted mind state, what do I need to do before getting into bed to make sure that I am fully present and prepared for that? So just something I wanted to throw out there from a mental health perspective. Rivka, this has been much longer than even anticipated. Exceptional time spent together. I
That's
really,
very fun for me
it
too.
really was
I'm
really
happy to do
good.
it. Yeah, I think that you have to think about sex as like these gears, right? You don't just like
Mm,
jump into like third gear or something. You
right.
you have to go slowly, and the first step is creating that relaxing environment, um,
Amazing.
relaxing touch.
Yeah.
Um, I
Yeah.
just want to say one more thing, is that I think that women just tend to do the sex. Like they just kind of tend to go through the motions. And it's often based on the man's timeline or the man's sensation of, okay, well, now I want to do blah, blah, blah. So I will initiate blah, blah, blah. And so it ends up being kind of on the man's timeline. And I think that if a woman is more in tune with like, where am I in these phases of arousal, or where am I with my gears or climbing the ladder or whatever however you want to put it, they can kind of slow things down a little bit and do a little bit more inviting. And I
Yeah.
think that that would go better rather than just kind of going through motions just because he thinks that it's time to move on to the next thing.
Right, right. Oh, there's so much here. Each of these conversations, each of these pieces could have so much more to talk about. But
Well, I'm happy to come
thank you.
back, and
We will have you back. We will have
yeah,
you
I'm
back.
happy to go back. It's very fun.
If you want to find out more information about Rivka, she's going to be tagged in the podcast. Rivka provides parenting classes, sexual health education classes, webinars, supervision, as well as individual therapy. Has a vibrant private practice located in Maryland. But definitely
And
reach out to
DC,
her. And
Virginia, and New Jersey.
thank you. And I figured you'd probably be licensed in other places as well. So making sure that you reach out to her website for resources and support. You are an amazing resource to this community. Thank you so much.
Thank you so much for having me.